Welcome to Pod Operations Training Auxiliary Medical. This training will cover the positions and job duties of the staff and volunteers who will be providing acute care, medical evaluation, Q&A, and behavioral health services at the pod. Please pay close attention to the information and instructions you are about to receive. At the end of this video, you will be given additional instructions by your supervisor. Again, we thank you for your willingness to serve in this important public health response. As you may recall, there are 4 stages to the pod process: triage, reception, assessment, dispensing, and Q&A exit. For some events, there may be a need for additional medical areas. For example, in some pods, there may be a medical evaluation station where a healthcare worker will finalize the medication selection for a client who has special needs or certain allergies or contraindications, or there may be an observation area for when vaccinations are given. At every pod, there will also be an acute care area to provide medical care to staff or client who may get sick or injured, and a behavioral health area for people in need of counseling or psychological support. As a medical professional or volunteer working in these stations, you will be responsible for evaluating and treating clients who may need medical attention or counseling as a consequence of the event or the stress that they may be experiencing. Let's find out a little bit more about the auxiliary medical positions in a pod and how they fit within the overall pod operations. Typically, the key positions in the auxiliary medical group are acute care nurse, medical evaluation nurse, observation nurse, behavioral health specialist, and Q&A expert. Depending on the scope of the incident and the size of the pod, there may be additional positions. As a member of the auxiliary medical group, you will report directly to the medical supervisor. As an acute care nurse, you will provide basic medical treatment for any injuries or illnesses that occur within the pod. Clients and their families may be brought to you if they present a critical health issue or purport to have any of the symptoms of the disease agent. For example, if someone is having trouble breathing, is experiencing chest pains, or has fainted, they may be escorted to the acute care station for evaluation or treatment. You may need to monitor the client's vital signs or stabilize the client until EMS arrives, and the client can be transported to a hospital or treatment facility. The medical officer will instruct you on the type of medical treatment you are to provide and at what level of emergency EMS is to be called in. The duties of the medical evaluation nurse may depend on the type of medication or vaccine being given at the pod. In some pod operations, you may be asked to assess clients with complex medical conditions for contraindications to the medication being given. For example, some medications, such as antibiotics used against anthrax, could interfere with other medicines the clients may already be taking. You will need to review the client's medical form, conduct an assessment, and determine which medications to dispense for each person on the form. If necessary, you may need to consult with the assessment pharmacist on possible drug interactions. Once your assessment is complete, you will mark the recommended medication for each person on the form, print and sign your name on the form, then direct the client on to the next step in the process, dispensing. In some pod operations, the client may get a vaccine and may need to remain on site for a short period of time. You will need to observe the client for any signs or symptoms of an adverse reaction using the guidelines provided by the medical officer in charge. Most likely, the acute care medical evaluation observation area will be issued a radio and instructions on how to use it. If a medical emergency does occur, please notify the medical supervisor immediately. If you get low on supplies or have any other issues or problems, notify your supervisor or a member of the safety or security team. Again, as a behavioral health specialist, you will observe both workers and clients for signs of stress and provide counseling and support as needed. Clients and staff may be directed to you if they are in need of evaluation or treatment for an acute behavioral health issue. You may also need to roam around the pod to observe people for signs of stress, anxiety, or mental fatigue. Stress and panic can be contagious in large groups, so it will be important to quickly identify those individuals in need and get them to a quiet, private area. You will follow your normal procedures for working with these clients and determining how best to provide psychological first aid. Should you observe a staff member or volunteer in need of care, please notify the medical supervisor so arrangements can be made for the person to leave their station to meet with you. Once you've met with a staff member or volunteer, you will give a recommendation to their supervisor on allowing their staff member to continue working. Should an EMS transport or other assistance be needed, please notify the medical supervisor immediately. Be sure to document all staff and client evaluations or interactions according to your standard professional procedures. If you are a Q&A specialist, you will be answering questions and providing final instructions to clients before they exit the pod. When the client arrives at your station, they will have already received their vaccine and/or medications for themselves and their families. You will need to instruct clients on the informational materials and forms that they have received and address any of their remaining questions. Your responsibility will be to make sure that the client understands all the information that has been given to them so they can take the medications properly. Whenever possible, gather a small group of clients together and brief them as a group rather than one at a time. Once you've provided the client with all the information they need and answered all of their questions, direct the clients to the exit and thank them for coming. As a member of the Auxiliary Medical Group, you play an important role in the overall pod operation. Remember, you will be evaluating and treating staff and clients who may need physical or psychological first aid. Remember, too, that a public health emergency can be stressful, and some people may have a hard time coping with their anxiety or fear. Speak to them in a calm and reassuring voice and offer them assistance if needed. Always ask the client if there are any questions you can answer. If you encounter any issues or problems, please notify a supervisor or ask for assistance from a member of the safety or security team. Thank you for your time and attention. You will now report to the medical supervisor for some further instructions.